we also did research with hospice patients because the third part of health-seeking behaviors is a peaceful death. These three parts were put together by Rosella Schlotfeldt. And a peaceful death sometimes is the most realistic outcome for patients with terminal trajectory in their illness. So that particular concept of health-seeking behaviors was very useful because it was very much ahead of its time when Schlotfeldt developed the idea of peaceful death being a healthy behavior. She said that in the 1960s. Quite amazing. And now the country and in their ethical discussions about healthcare and costs and dignified deaths, we're coming around to appreciating this now. But nursing has always been in the forefront of trying to promote peaceful deaths, rather than, say, suicide, assisted suicide. Yes. We've never supported that as an option. And we believe that with all of the knowledge we have in palliative care and hospice nursing, that patients should not suffer.
Right.
If they're suffering, then something can be done to help mediate that suffering so that they do not feel the need to have assisted suicide. So that is the test of the second part of the theory. The test of the third part of the theory would be the relationship of these health-seeking behaviors to institutional outcomes. And the concept that I coined to capture that idea was institutional integrity. And the idea of institutional integrity was the wholeness and health and ethical system and financial systems of the hospital itself. And that concept has been a very popular one with nurse administrators, which of course was why I added it to the theory later on.
Is that in your book?
That is in the book, and it was not a part of the original theory. It was in response to the trend in healthcare to have managed care with diagnostic-related groups called DRGs. This whole swing away from a more generalized approach to doing what was best for the patient into doing what was healthy for the hospital was a real challenge for nursing as a profession. And that is why I came up with that last concept. And
now hospitals also need to measure patient satisfaction,
and
correct?
Yes, patient satisfaction has become a national item on the report cards for hospitals, where patient satisfaction scores are actually compared across hospitals on public websites. And so this idea of institutional integrity preceded not only patient satisfaction scores being nationalized and the competition between hospitals for patients and insurance premiums, it also preceded the drive toward magnet status, which was instituted by the American Nurses Association to improve the working environment. And for nurses, this was an initiative to try to halt the burnout of nurses, and which would cause them to leave the profession.
Magnet status.
Magnet status. And in my book, I briefly mentioned that I was becoming interested in nursing, the comfort of nurses, as well as the comfort of patients. I was now becoming interested in the comfort of nurses. I did not elaborate on that in the book, but it did kind of set the groundwork for my working with the institutional level. Nurses who have elected to go for the magnet journey in their hospital often are asked to pick a theory which will be their guiding framework. And this is actually a strong suggestion by the magnet evaluators that each hospital have a theory, because the advantage of working with a theory is everybody's on the same page, and you can bring in, because it's comfort theory, presumably all of the hospital workers are interested in the patient's comfort,
Yes.
which would include the maintenance people and the engineers and
the finance people.
Finance and the people who pass trays and the people who do social work, pharmacy. All of those disciplines can get on board with the idea of increasing patients' comfort in their own job descriptions, through their own job descriptions. So I find that comfort theory is quite popular when hospitals choose to go on this journey. This journey costs the hospital about $6,000.
The magnet status?
Yes, to achieve magnet status.
Really?
It is extremely expensive and resource intensive. And
Yes.
everybody really has to want to do this.
I understand that because I know from one hospital here that the document they submitted is huge.
Huge.
And it incorporates all the nurses,
Right.
their opinions or their
Right.
their input somehow.
Right.